the legal definition failed miserably. It never actually prevented genocide. And so Doctors Against Genocide was born as a way to mobilize healthcare workers to use their influence, to use their diagnostic skills to understand, the signs and symptoms, and then have the authority to actually sound the alarm and trigger a reaction. And hopefully we'll get there. But that was the premise.
Yeah. I stand by my original statement that it's absurd to me that we need to have an organization called Doctors Against Genocide. It almost seems like if you had shown me that years ago, I would have thought it was like an Onion article. Like that's how, yeah.
I mean, what does it have to do with doctors, right? It's illegal.
Well, no, it has everything to do with doctors, but of course they would all be against genocide.
Yeah. But I mean, all the legal frameworks failed, obviously, because we're seeing more violence, not less.
Yeah. And that brings up, Peter, do you want to say something about
you first.
Okay. No, I was just going to say one of the things that we're going to talk about later that it's not worth getting into detail now is that what this crisis in Iran is doing as far as the effects on global healthcare. And one of the articles that I saw that I thought was really interesting, sort of bring in like to what you're saying, is this idea that there needs to be this global sovereignty over healthcare that's independent of conflict, that's independent of global governance, and it needs to be almost like an international sovereign medical type of thing that would protect supply chains and protect people. And it just made me think of that's what they were trying to talk about in terms of protecting the helium supply, because apparently that's now a big problem. So this is one of those things where, doctors should have a lot more weight in what they're saying. And I think it is so important. And I do think that other than the crazy Zios, most people do respond with a level of respect when physicians stand up and say something is not right. It's only when the Zios are involved that I think that.
I think Yuval will tell you more about this, but I think also doctors are not all innocent, right? We've seen what happened in Israel with the doctors actually calling for the bombardment of hospitals. I mean, what doctor, who saw, who has any ethics would actually sign on that? And then now with the death penalty, we've seen doctors actually volunteer, raise their hand, I'll execute Palestinians. So, I mean, medicine itself is a very problematic field, and it's influenced a lot by colonial frameworks, and it needs to be decolonized for medicine to actually work. Because in a capitalist society, doctors are incentivized to be profit centers, right? To be, to push invoices instead of treat and heal people.
Geja and Nidal, if you could both speak to the PTSD that so many doctors and nurses are obviously suffering from. Obviously, you have seen what's happened over the past 2 years plus when it comes to targeting hospitals, when it comes to targeting journalists, and obviously when it comes to targeting doctors. I mean, we all have a very probably strong and similar opinion about the state of Israel, but I don't think it gets talked about enough. There is this kind of glossed over opinion about people in the medical field like they're superheroes or something, that they are immune to the ravages of war and in this case genocide. But we'd like to hear your thoughts on just how detrimental it's been for people in the medical field.
Unmute.
Yeah, so in the medical field, as Maisa mentioned, we're kind of like the first responders. And all the consequences of these wars, of these crimes, war crimes and genocides, we are the ones who usually face them firsthand. And we go to school usually. We go to medical school for 10 years, 15 years, 20 years, just to be able to save a life. We spend days and nights in the ICU, a whole team of doctors trying to save a cancer patient or a critical patient. And that takes a toll on us. So doctors are human beings and they do feel with the patients. But when the illness is natural, when the illness is due to a natural disaster, we at least understand, is it, an accident? Is it aging? It's just cancer, natural things. It's something beyond human control, and we have to deal with it, do our best again, with all the skills, all the education, all the technology that we have to save a patient here, a patient there. But when you are in a area, in a hospital, or among a population that you see that tens of thousands of people are being slaughtered, are being blown to pieces intentionally, and a man-made intentional action that could have been stopped if the world listened to what the Palestinians have been talking about for 100 years, or if the people listen to all communities that are under oppression or occupation or being, exploited. If the world intervened early and really came to the rescue and stopped this aggressor from exploiting them, from putting them at risk. So when you are as a doctor seeing all this, first of all, there is only so much you can do. I mean, if you bring me a child cut in 10 pieces, there's only so much we can do. Our colleagues who are in Gaza reported for almost more than 100 days that each one of those partially functioning hospitals, we know that all hospitals have been damaged and targeted and attacked, but each day they are facing at least on average 10 mass casualties every day. Each mass casualty, you are talking about 50, 60 people dead, 200 severely injured cases because when you are throwing 2,000-pound bombs on people, these are the most lethal, the most sophisticated weapons in the world. You're not talking about just simple injuries. We are here in the United States. I imagine every hospital in the United States, if you have just a major car accident, 5, 6, 7 cars, and you get 20 casualties to the biggest institution in the United States, the whole institution goes into emergency mode. And, sometimes they start, beyond 10, 20 cases, they start sending them to other hospitals. Imagine a hospital in Gaza that don't even qualify as hospitals. These are just small buildings, have already been under siege for 20 years. Each one of them has been bombed many times. You have to deal with 200-300 cases, and every 2-3 hours you get another bombing, and you have to deal with these, and you have to triage patients. We have seen the scenes. Our colleagues told us, like, you have to look, you have 20, 30, 40 people, and you just only, that their capacity is only to save 4 or 5 of them. So you go and you have to choose. Just the fact that you have to choose, that you can only save 2 or 3 of them, the ones who are not as badly injured, and you don't have the capacity or the time to look at the others. You just let them die in front of you, in front of their families, because you cannot do it. That is a scar. That is a scar that is deep. And it will never leave us as doctors, healthcare workers. It's a scar against humanity, against our 21st century international system, that we are allowing this. And again, as I told you, we usually try our best. We are there. This is our job. But again, when it's natural, when it's something expected, that's okay. But when a country like Israel, because it has been offered impunity for more than a century to commit every crime under the sun, to violate every international law, to violate every common human basic decency for so long, and every time you think they cannot get worse, every time they come up with new ways of destroying lives. This country has been a source of destruction, a source of evil, a source of instability for the whole region, for the world, for the last at least 75 years since it was established. Again, I mean, that's what actually, what Jen mentioned. That's why we established Doctors Against Genocide, because the politicians have failed us, the international system have failed us, the UN has failed us, and we thought that we, the people, especially the medical community, each one of us has a responsibility. But we, as a medical, community, if the medical community nationally and globally mobilize, we do have the power, we do have the status actually to affect change, to pressure politicians to do the right thing, and not to wait until things escalate into the mass atrocity that we have been seeing. Because in medicine, we always value prevention. Prevention saves more lives than you wait until the bombs start falling. Once the bombs start falling, there's only so much you can do. When you have 200, 300, you can save 5 or 10. The rest of them are gone. And even those you save, they're going to live with lifelong disabilities and deficiencies. But if we can prevent one genocide as a medical community, if we can stop one war, if we can stop this mad war in Iran that Trump is doing, that is about to even escalate, we can save more lives than what we can save in our clinics and hospitals for decades. That's why we came up with this concept that actually for the medical community to mobilize and intervene in this is actually medicine. It's not politics. This is a medical intervention, because if our job, if our oath obligates us to protect life and prevent the loss of life, like we do vaccines, like we do screening for cancer, we can save more lives by solving conflicts peacefully before they escalate, stopping wars, stopping genocides. This is a more return on investment if I want to do it in a business comparison. But we can save more lives as doctors, as healthcare workers, if we use our voices, our presence. And again, as Maisa mentioned, unfortunately, the majority of the medical community is complicit, especially the Western institutions. But this is our goal. We cannot stay silent. We want to mobilize, and hopefully we want to become the mainstream that the healthcare workers, the doctors, and other civil societies in the world have the say and more power over politicians to stop this. We can create and we can imagine a better world for all of us. Wars, bombs never solved any problems.
It's true. No, I mean, to me, war is the sign of failure. If you're having to use weapons, then you failed. You failed at being able to humanely deal with your conflict. So you've already failed. But I wanted to ask you, Mesa, like, what kind of like support networks or stuff do you guys have you even? I'm thinking about all these doctors that are serving and are going over and doing rotations essentially in a war zone and seeing stuff that nobody is supposed to see. Like, this is beyond even what doctors are supposed to see. So what kind of support, is there anything that you guys have? Like, is there anything being done for some of these people when they come back from, I mean, I can't imagine the PTSD.
Yeah. And you say PTSD for the people of Gaza, it's not actually PTSD because it's
no. I meant yeah. That's another. No, that's just TSD. Oh no, absolutely.
And it's long term, and it changes people. People often come back and say, "I'll never be the same again." It's a couple of things. I think I think we haven't really talked about what DAG is like. Just generally, like as an organization, and then I'll talk about how DAG actually supports humanitarian doctors and doctors who go on missions and all healthcare workers actually who are very sick from genocide. And it's something that we actually felt ourselves, and that's one of our campaigns. But Doctors Against Genocide, like we mentioned, it started because there was a deficit, right? Like the legal system wasn't working, the people were not centered. The oppressive powers were just kind of going all in on dehumanization and then creating genocides all over the place. And so Doctors Against Genocide started as an advocacy organization. So to bring all these healthcare workers, use their collective influence, and then come up with advocacy tools, training, and ways for these doctors to be able to mobilize and influence policy. The other thing we do is we educate, because doctors are not trained on genocide, right? They don't know the signs, the symptoms. They don't know how to use their voice to actually advocate appropriately for the people that they serve. So we created an education kind of component for that. And then the last part, which is the community support. And this is where we center the voices of the people impacted by genocide. We create campaigns that bring people together to provide that support. So we have, through fundraising, and we hesitate to even call it that because it's really community support. It's allowing people who care to use their money to directly, positively influence the outcomes for the people who are impacted by genocide. And so when these doctors go on missions, what we often hear is that they go and they're like, obviously they're never prepared. You can never prepare for what you see, because as Nidal mentioned, the mass casualties alone, like the volume, the sheer volume of these injuries and the intensity is just completely beyond anybody's imagination. But the other thing too is that you go in and you work with colleagues who have been doing this for months, right? So a lot of them have been either detained, some of them have been killed, their families are under the rubble in some cases, they haven't seen their families for months. So they're also confronted with seeing their colleagues, operate under the most unimaginable conditions. And the other thing they all say is that the doctors in Gaza, the healthcare workers in Gaza, are exceptional at providing care. Despite all these circumstances, they're resilient. And again, we don't want to make them sound like heroes because they're human, and they hate it when we actually almost romanticize their sacrifice. It's not their choice, right? They're put into this situation, and they choose to serve. They choose their patients every single time. And the story of Dr. Hussam Abu Safiya and other doctors who have been arrested just simply because they're doing their job. And even when doctors want to go to Gaza, right now, Israel prevents 50% of those doctors from even entering Gaza, and now the West Bank, because I think the West Bank is heading towards kind of an escalation in this genocide.
Mm-hmm.
And so I'll go back to the sick from genocide phenomena, because Nidal mentioned that doctors are trained to save lives. That's just who they are as people, right? So when you're confronted with this moral injury, right, like you see those people attacked, children, with shrapnel injuries, that you see the dismembered people, the largest cohort of children amputees. You see all this atrocity, and you cannot help, and you feel like your institutions are betraying you, right? Your hospitals are betraying you and oppressing you. Your medical associations are oppressive, and they're not saying anything. And then your government, your tax dollars, are sending money and weapons and diplomatic cover for Israel to continue these atrocities. So the doctors feel sick, and we call this sick from genocide. It's that moral injury of really wanting to help and do something, but not being able to. And so the solution for that, ironically, is taking action. Is what we do, is our advocacy efforts, is going to the Hill every month, and then having these meetings and demanding that our politicians are accountable. And then to that end, I want to say that we have an event coming up on April 15th where we're getting 1,000 healthcare workers to join us, because enough is enough, right? Like, what else? Like, what else do we need to do? Like, where else do we need to have a war? And how many more thousands of people need to die, without any fault of their own before this ends? And so we want to mobilize as much as we can. So the solution for the PTSD or the sick from genocide is actually taking action and being part of a community that is all aligned the right way. We're aligned towards our moral values, preserving life, and fulfilling the oath to do no harm in the right way, right? Not the passive way, but to actually actively do something about it.